months to years of structural or functional cardiovascular remodeling. Right? Structural or functional cardiovascular remodeling. So, in the pathophysiology, just important that etiology causing the heart failure is not important for us. That particular etiology, which is the index event, how is it causing the structural and functional cardiovascular remodeling, that understanding is very important for us to give the specific treatment, right? And this particular index event or the primary event, it may be sudden in onset. Where do you have this sudden in onset of heart failure? Like you take in patients with acute myocardial infarction, or it might be, right, or it might be gradual in onset. Where can you have this gradual in onset? That is in patients with cardiomyopathies, or you take in patients with the congenital heart diseases, okay, or you take pressure overload conditions like hypertension or the aortic stenosis. So it might be gradual. So the primary event, it might be either acute or gradual in onset, right? But what is very important is the consequence of that primary event is very, very important, right? So despite an initial reduction in the cardiac performance, patients may be asymptomatic or mildly symptomatic. Why and how? Even though there is reduction in the cardiac performance, why is that the individual is asymptomatic? The reason is because of the activation of the compensatory mechanisms. Right? Activation of this compensatory mechanisms, right? And what are these compensatory mechanisms? These compensatory mechanisms include, number one, activation of the sympathetic nervous system. Number two, activation of renin-angiotensin-aldosterone system. Number three, non-osmotic release of the antidiuretic hormone. So these are the compensatory mechanisms that makes the individual being mildly symptomatic or asymptomatic, right? Now let me just give you the sequence of events that will happen, and why that particular events happen, I'll be discussing in this pathophysiology. So now in these patients, there is either systolic or the diastolic dysfunction that develops, and that could be because of the index event, right? That is either acute event or the chronic event. Now this particular systolic or diastolic dysfunction, this is occurring as a part of a stimuli, that is nothing but the index event, and because of that systolic and diastolic dysfunction, the individual is developing an increased wall stress. Why is this increased wall stress? That is because of your ventricular enlargement, right? Then actually all these events, they are in the form of a vicious cycle. One particular event starts first, then consequently there will be the systolic or diastolic dysfunction, and that will progress to, there will be remodeling stimuli. See, once there is, what did I tell you just now? There is activation of the compensatory mechanisms, and these compensatory mechanisms, they increase the wall stress. Why? Because your sympathetic activation of RAS, they will increase the afterload on the heart and increasing the wall stress. And there is also the release of the inflammatory mediators, that includes cytokines, and there will be neurohormonal oxidative stress.